Another harm reduction strategy is the syringe service program or syringe exchange program. And these programs promote public health and safety by taking syringes off the streets. So part of the syringe exchange program is folks can get these plastic containers in which they can put their syringes, their used syringes, in the plastic containers. Some folks will bring these plastic containers back to the syringe exchange. Some folks, you can deliver them at the hospital and the hospitals will take care of them. Some folks, some areas, it might be drugstores that take them back. So you, again, will want to do some research about what is available in your area. We have found, I work closely with an individual who's very involved in the syringe exchange program in New Hampshire, where I am currently, and they report the numbers like one person will come to the syringe exchange program with upwards of 1,000 dirty syringes that they take from all of their friends and bring them back. And so if we think about one syringe exchange program taking back over 1,000 needles from one individual who's representative of a group of individuals in one town, in one state, we can think of a much larger scale. How many syringes are we keeping off the streets, off the playgrounds to promote public health and keep people safe? Syringe exchange programs protect law enforcement and other personnel from needle stick injuries. Syringe exchange programs do not increase crime or drug use. People are going to use anyways. They're going to use whether they have a clean needle or not. So let's at least allow them to prevent disease and prevent others from getting hurt. It is cost effective, decreases new cases of infectious disease. So Hep C, Hep B, Hep A, and HIV, AIDS. People who inject drugs are 5 times more likely, 5 times more likely to access substance use disorder treatment, and 3 times more likely to stop injecting if engaged with a syringe service program. And the reason for that is because there are, as the last bullet says, opportunities for multiple intervention services, referrals, help getting healthcare, discussion about their substance use. It's an entry into medical care. And what's really most important is many of the folks that are working in these syringe exchange programs are survivors of substance use disorder themselves, mostly survivors of injection drug use and overdose. And these folks can empathize with the people that are using the syringe exchange program. And they are building such a trusting relationship that when an individual does have the idea to stop using, they have someone to talk about it with. They know that every Friday they can go talk to Ryan or to Andrew or to Courtney or to Bryn, and that's what's happening. That's why you see these numbers, like people who inject drugs are 5 times more likely to access treatment if engaged with the SSP. The numbers don't lie, folks. These programs are working and people are connecting, they're bonding, and they're asking for help. They know where to get help when they're ready. So we like to educate people on harm reduction strategies, educate on safe use. And here's a conversation that you can have with other individuals. All right, so you're probably wondering, what are some of the things that you can do to support and promote some harm reduction strategies that help save people's lives. So I've created this list. Actually, this is not my list, it's somebody else's list. But I have included it here in this slide. And one of the things that we can do is, if you know someone is using drugs and they're injecting them, we want to start engaging in safe use conversations. And that might sound a little strange, and it can be somewhat difficult to engage in this type of a conversation. And more professionals, especially in the recovery coach field, are embracing this type of engagement and communication with individuals who are having a very difficult time discontinuing use, and maybe they're not ready yet. And what we say to them is, how can we help you stay alive, right? You're going to use, we're not going to try to talk you out of using. What we do want to do is support you through this use to keep you alive. So here are 10 harm reduction strategies that you can engage with in conversation with individuals about. And it starts off with, don't use alone. And what we promote, or what we discuss, is stagger the use with someone else. So if you're going to use and somebody else is going to be with you, they will use first, and then you will wait a period of 5 to 10 minutes, and then you will use. And then that way, if one of you does overdose, then you've got your Narcan, or you can call 911 and save their lives. They call it fix with a friend. Another option is you can try a tiny tester amount first. And we engage in conversations, and we say to individuals, you can do more later, but you can't do less after. So start with a smaller amount first, and then use again when it's appropriate for you. Go slow, right? Take this process slowly. Get high, but don't die. Wait to use until you feel in control. If you don't feel in a safe situation, if there's some chaos going around in your environment, for some people it can be family members are home. For some people it can be at work, or maybe they're in the bathroom somewhere. We invite people to think about using more safely when they're not in such a high stress situation. Choose your setting wisely. And if you can imagine this type of conversation with somebody where they're not hearing from the helper, just stop using, don't do it, you're going to die. What we say is, listen, you choose your setting wisely, because fear does cause you to make mistakes, and you could make a mistake. Can you imagine how that might make them feel cared about and maybe not judged? It's these little subtle behaviors, and we talked about this in Module 1 and Module 2, these subtle behaviors of ours as the helpers that can reduce stigma, reduce shame, and help individuals build up a little self-worth, enough to say, I don't want to live like this anymore. Mixing drugs increases risks. Mixing alcohol and benzos with anything increases your risk of death. Again, we're educating people, we're having conversations, and we're planting seeds so that when they do use, hopefully they're choosing to use in a safer manner. Limit your use while you're sick. Illnesses that affect the heart and lungs increase overdose risk. Drink plenty of water. We hear that all the time, right, with everything. It prevents illness, it increases blood flow, and you feel better when you drink more water. In recovery centers and some first responder programs that are actually doing community outreach and going out into homeless camps, they're actually bringing water with them and they're handing it to individuals, because this is one of those really subtle approaches that will build trust. You can help a person feel worthy of something and that they're not being judged. And so this drinking plenty of water actually helps an individual. If they can start to drink more water on a daily basis, they're already starting to be more mindful of their behaviors. And so what harm reduction strategies does is it helps people think about the behaviors that they're doing, and it starts to plant seeds for improved health and well-being, which is in SAMHSA's definition of recovery, right? Change the way you use. Try snorting or smoking instead of injecting. It may save your life. And we ask this question, have you ever thought about snorting? What would it be like for you to smoke instead of injecting? Is that something that you'd be willing to do? Hard conversations to have, but really essential to have them. Test your drugs for fentanyl. There are various agencies where you can get free test strips. Again, I invite you to do some research for your location, and you can always go to harmreduction.org, the National Harm Reduction Coalition, as I believe they have some opportunities you can explore to get free test strips. And then carry Narcan and know the signs of an overdose. Carry naloxone, know the signs of an overdose. These are all important things. This is a very important thing for individuals who do injection drug use, to have Narcan on themselves, and also provide Narcan to their loved ones, so that if they overdose and their loved one happens to find them, that their loved one knows where to find the Narcan. And the signs of overdose, they're quite simple. What we suggest is that you put this information on a brochure or what's called a rack card or a flyer, and you have it posted in your areas, in your centers. You hand it out to people that you're working with. You engage in conversations about these harm reduction strategies to educate people, to make improved decision-making, improved health and well-being, and to save lives. Harm reduction strategies that lead to empowerment. So we look at the traditional system, which we're moving away from. It still is very much live and existing, functional in our world today, but we're trying to move to a recovery-oriented system. And some of the language differences that we can see with a traditional system might look like, you need treatment. In a recovery-oriented system, we say to individuals, what do you need? In a traditional system, we say, you need to ... You need to do this and you need to do that. In a recovery-oriented system, we say, what do you want to work on? What does your future look like? And we give them the power of control. We all need it. It's a human biological function. Traditional system, we say your goal is to be abstinent and manage systems. And we say in a recovery-oriented system, what do you want your future to look like? What does it look like for you in 1 year if you're actively using these same drugs? What does it look like for you in 1 year if you're not using drugs? This is the program you need, traditional system. What do you want to work on? Would you like to establish some drug use goals? Maybe you'd like to work on something else. And then the traditional system says, if you leave this treatment center or this rehab, you're done, you can't come back. In a recovery-oriented system, we say, if you leave, we want you to come back anytime. The door is open. Here's our phone number. I think it's very clear to see this harm reduction model in the traditional system and the recovery-oriented system, how this is so much more inclusive and empowering and autonomous versus directive. Harm reduction strategies that lead to empowerment. We've got the Never Use Alone website, which I showed you earlier. This is their information. You can see here, this was approximately November 2021 when I found these statistics. Calls received from Never Use Alone was 2,156. Out of those 2,156 calls, 12 EMS calls were made and 12 lives were saved. And I would venture to guess that by the very nature of an individual using this resource, they're going to be using more cautiously, more carefully. They probably have Narcan on them or their loved one has Narcan. So it's all around safer use and improved behavior. This falls under improved health and well-being and reduced negative consequences associated with drug use. Harm reduction works. Mutual aid support groups. This is Harm Reduction Works. It's a very new mutual aid group for folks who prefer the harm reduction model and have experienced some stigma from Alcoholics Anonymous, Heroines Anonymous, Narcotics Anonymous. A stigma exists in those mutual aid groups as well. And so they've created this harm reduction mutual aid support group. Harm reduction strategies for youths. There's so many folks, I couldn't put them all on this website. I really encourage you to do some research, connect with your regional public health networks, connect with your state advocates for substance use disorder, both in youth and adults. So Safety First for Teens, Drug Policy Canada, New Hampshire Harm Reduction Project, 7 Challenges for Adolescents, Alternative Youth Peer Groups, Building Power and Equity with People Who Use Drugs. We do it with them. There's a saying in the recovery world, nothing about us without us. We have a voice. We have a right to be at the table with people who are making decisions about our treatment, our care, and our lives. And we want to be heard, and we want to make a difference, and we want to have a positive impact. Nobody wakes up and says, you know what, today I think I'll become an addict. Join the movement, harmreduction.org. Find out more information on harmreduction.org, folks. How you can help in a positive way. Don't make decisions for the individual. Don't make them for me. Help me to make them for myself. How can I see a better future for myself? Help me feel like I have some control. Present me with choices. Seek to understand that I don't want to be an addict. It is extremely hard to figure out how to stop. Remember, empathy is the antidote to shame. Figure out and try to get where people are feeling. Try to understand their suffering and their despair and connect with them and help build them up to get out of it, not bring them down. And lastly, let go of the outcomes. By you telling me what I should do and what you think I should do and what I need to do is probably not what I'm going to do. But if you give me choices and then you leave those choices up to me and you realize that you don't really have any control over what I do the minute we leave this engagement, you might like to think you have some control by sharing what you think I should do. But ultimately, when it's all said and done, I'm the only one that can own my own outcomes. You can't own them. And this is critical for helpers because we must understand that the best that we can do is show up as the best version of ourselves and be armed with the right information and the right approach to support people in moving towards their goals. And that in doing so, we release them from owning those outcomes can improve our self-care, because we can't take all of the disheartening stories that we hear on a daily basis home with us every day, because our longevity in this field will be short-lived. Our lives will be compromised. Our families' lives will be compromised. So please understand that this letting go of outcomes is twofold. It's for the benefit of the individual you're working with, and equally as important, if not more important, it's for the benefit of you and your family. Understand that I own what's in my hula hoop, and you own what's in your hula hoop. Help me learn to exercise good decision-making, good self-control, and understand my own personal power. That's harm reduction, and that's how we can help save lives. Remember that a person is in recovery when they say they are in recovery. It's whatever it looks like to them. And we are not in a position to judge what it should look like for them. And if somebody says that they made it through 24 hours without a drink or a drug and that they're in recovery, we celebrate that, because it's a big deal, folks. It's the first step in many, many steps towards abstinence or sustained recovery. And remember, improved health and well-being reduce the negative consequences associated with drug use. How do we keep people safe? Individuals who use drugs, their families, friends, and society. Remembering that not every recovery journey is going to look the same. There are twists, there are turns, there are winding roads that lead back to the starting point. And what we can do is walk with people through this journey until they reach their self-defined destination. Change your narrative, folks. You've been through some quality information of 6 modules about addiction and recovery. And I hope by this time, in closing, that your narrative and your outlook has changed on those who experience substance use disorder and how you can better help. It's important now that you take this information and you share it with others to help continue to reduce stigma, so that those who need help and want help aren't afraid to ask for it, and they get it. That's how we make a difference in this world, one person at a time. The reality is that not everyone can achieve abstinence, their drug use goals, or sustainable recovery. But the liability, folks, is thinking that no one can. What do you think? Everybody's different. Don't judge. Instead, understand. And I thank you for joining us in this training series. Reminder, these are some of the trainings that Choices offers, and we're so proud to partner with Pine Tree Institute to create trauma-informed communities. My name is Ginger Ross. I've been your host, and it is an honor to serve you. Please feel free to reach out to me with any questions or comments, and I am always available to train in your establishment or in your communities and do some live trainings for you. So peace be with all of you. It's been an honor to serve you, and let's look forward to being the change one day at a time. Thank you, folks. Hey there, this is Ginger. I hope you're learning a lot from this series. I'm asking for your help in supporting my tireless efforts. There's a few ways in which you can support me. Tell your friends about this video series, subscribe and like each video here on YouTube down below, make a donation on my website, or invite me to deliver this training in person. Together, we can all be part of the solution. Hope to see you soon, and thank you.